Welcome to our video about zirconia teeth. Are they a good idea? If you've been considering getting a set of zirconia teeth, you've probably wondered if they're a good idea for you. Although the material is very similar to titanium, zirconium dioxide is not a metal. Unlike metals, it doesn't cause a strong immune response and is relatively safe for most people to have in their mouth. People who have metal allergies may also consider getting a set of zirconia teeth to avoid any potential problems. Y-TZP. A 3D printing method has been developed for dental Y-TZP. The slurry used for the printing process is composed of 58 volume % Y-TZP powder and photocurable monomers. The printouts are green in color and each layer contains a different amount of Y-TZP. The DLP process creates dental prostheses with very high degrees of accuracy and allows the design of complex structures, including zirconia teeth. Y-TZP is a unique material with several characteristics. It is an alloy of zirconium, titanium, and yttrium. At room temperature, zirconium exists in a monolithic phase and is extremely brittle. Through a sintering process, Y-TZP becomes stable and forms the final ceramic structure. This alloy is often used for dental prostheses. Y-TZP has excellent biocompatibility and mechanical properties. It also has excellent aesthetics. To test its biocompatibility, scientists prepared 50 femoral heads of different diameters. They then divided these 100 prepared teeth into 5 groups of 20. Using the 3 measurements, they compared the mechanical properties of the Y-TZP teeth to their counterparts. The results of the tests were compared to those of lapping and face grinding. In general, the Y-TZP teeth were significantly stronger than those of the other 2 materials. The hardness of zirconia allows for a smooth surface and minimizes antagonistic abrasion on opposing tooth enamel. The fine-grained structure and glass infiltration treatments minimize in vivo degradation. However, it is important to note that zirconia teeth are not immune to acid attacks. For this reason, dental technicians should carefully follow specific guidelines when fabricating them. In addition to adhering to the recommended guidelines for the fabrication process, clinicians should keep in mind the differences between these materials when preparing these teeth. Layered zirconia. There are 2 types of zirconia teeth. One is a monolith, and the other is layered. Both are extremely strong, durable, and aesthetic, but layered zirconia is the best choice for front teeth. However, both types have the disadvantage of being harder to clean and tend to be more expensive. Fortunately, multi-layered zirconia is available to replace teeth in just a few visits. Multi-layered zirconia, ML, is comprised of 3 different layers. Each layer is composed of different amounts of the same material, but they differ in their composition. The resulting shades of the material are very similar to those of natural teeth. It is also important to note that different multi-layered zirconias have different levels of translucency, so the results will be slightly different. However, a lot of this information is not yet available. While both ML and STML contain similar amounts of yttrium and cubic phase, their differences include their compositions and translucency. For instance, the UTML is more translucent than STML, but both grades exhibit slight differences. Interestingly, STML and ML differ in their levels of pigment, which makes them more resistant to limited than STML. The difference in composition between these 2 materials is minimal, although they are very similar in terms of mechanical properties. Y-TZP polycrystal. Y-TZP is an acronym for yttria-stabilized tetragonal zirconia polycrystal. Y-TZP can be colored with rare earth oxides like PR6011 or ER203. During the process, the tooth-like Y-TZP was formed using an internal coloration technology. The colorants used were PR6011, CO2, and ER203 or transition element oxides like NO2. Various mechanical properties were determined using a fracture model by a scanning electron microscope, SEM. The 6 tooth-like Y-TZP exhibited flexural strength of 960 megapascals and Vickers hardness of 960 MPa, respectively. When exposed to external stresses, Y-TZP undergoes the TM transformations. The resulting expansion of grain boundaries absorbs energy, affording damage resistance. Because of its combination of high toughness and strength, Y-TZP has become a standard dental ceramic for prosthetic restorations. The resulting tooth-like restorations are much stronger than conventional composites and can last for many years. Y-TZP provides enhanced mechanical and optical properties. Although Y-TZP is not as aesthetic as traditional glass ceramics, it has similar properties to zirconia and is used for monolithic restorations. Y-TZP polycrystals provide strength and translucency, which is a desirable combination for interior restorations. However, patients with discolored teeth should be cautious when choosing a zirconia material for their smiles. Y-TZP layered zirconia. A primary benefit of Y-TZP layered zirconium teeth is the increased translucency of the material. As a result, a monolithic zirconia anterior crown can be made. The material can also be manufactured as a multi-layer type, with several layers of pre-shades that make color tone adjustments easier. This material is often referred to as M5Y. Although the materials are made from zirconia, they are remarkably tough for dental prostheses. As a result, Y-TZP has replaced metal alloys in many applications, including fixed dental prosthesis. This material undergoes a phase transition from a tetragonal to a monoclinic crystalline state, and it reacts to unfavorable tensile stresses, which makes it highly durable. Aside from the advantages of Y-TZP layered zirconium oxide, these materials also offer some benefits. They are much stronger than metal and titanium and can be made to mimic natural teeth. In addition to being strong, these materials are very translucent. In addition, Y-TZP can be adapted to various clinical settings. Whether they are permanent or temporary, patients can be confident that they will look great after their procedure. The durability of Y-TZP layered zirconium teeth is also very good. The fabricated teeth can withstand bruxism, abrasion, and abrasion. There are a variety of factors that determine the wear of a zirconia tooth, and some of them are beyond our control. High surface polish is one of the advantages of this material. Full ceramic zirconia. If you want to give your smile a facelift, consider getting full ceramic zirconia teeth. These restorations are more durable and biocompatible than other dental materials and offer an excellent aesthetic appearance. However, there are some drawbacks to using zirconia for dental restorations. Here are a few of the most common disadvantages of full ceramic zirconia. Zirconia crowns are much stronger than metal crowns and are thinner than enax dental crowns. Because zirconia crowns are so thin, they require little tooth tissue to be removed for the procedure. Additionally, zirconia crowns are more natural looking than metal crowns and are a popular choice for cosmetic dental purposes. Zirconia is available in many forms and can be fitted to fit different mouth shapes and needs. In the past, studies have suggested that there are many reasons for chipping and fractures of veneered zirconia frameworks. One of these is a bond failure. The bond between zirconia and veneering material is compromised by sintering. The process can introduce thermally induced residual stresses. Another potential cause of chipping is poor core wetting. Additionally, color pigments can affect the bond strength of zirconia with veneers. Another drawback to porcelain crowns is the need for a separate lab. Creating a porcelain crown usually requires a separate visit to the lab, which may take weeks. It also interferes with CT/MRI. Full ceramic zirconia teeth are preferred by the international dental community. There are 3 main steps to creating full ceramic zirconia teeth. If you're looking for a great smile makeover, consider getting full ceramic zirconia teeth. Preparation of zirconia teeth. Whether preparing a patient's natural tooth or a zirconia restored one, the final dimensions of the prepared tooth will vary. Typically, a full contour zirconia crown requires an overall reduction of 0.7 to 0.8 mm. Layered zirconia crowns may require even more reduction. The following procedures can be used to prepare a patient's natural tooth. The most commonly used method is CAD/CAM. This method involves milling a fully sintered zirconia block, ensuring no distortion during the machining process. However, this method also involves flaws that compromise the mechanical properties of the zirconia structure. Pre-sintered zirconia has a final mechanical property that is dependent on the diameter of the abutment and its density. A chamfer is an important element when preparing a zirconia restored tooth for a zirconia restores crown. This chamfer helps the crown fit well in the patient's mouth. For posterior zirconia crowns, a chamfer should be visible along the tooth's wall. It should also be tapered from 4 to 8 degrees with a continuous circumferential chamfer. It should also be rounded at the gingival margin. The procedure of fitting a zirconia restoration requires marginal finishing. A gingival margin must be cleaned of excess cement so that plaque does not form. Plaque on a zirconia restoration can result in periodontal disease. Afterward, gingival margins can be finished with a non-cutting safe end finishing burr. These methods are generally less invasive than a chamfer preparation, and they may slightly roughen the surface of the zirconia restoration. However, they should be smooth enough to polish easily and accurately. Thanks for watching. Please like, comment, and subscribe for more.